Hello, friends. Good day, all. I welcome you back to our YouTube channel lecture series, Hematology and Blood Transfusion Science Lecture, a channel where we discuss different topics in hematology and blood transfusion science. Thank you very much for your support so far. You've been great. Thank you. For some time now, I've had requests to do sample questions on the topics that we have treated so far. So today, I decided to do multiple choice questions and answers on iron, topics that we treated under iron metabolism, iron deficiency anemia, regulation of iron homeostasis, iron absorption, iron homeostasis, hemochromatosis. I believe strongly that these questions and answers will help you immensely to do better in various exams that you will be engaging in. Thank you very much. As I share my slide with you for us to go straight to the questions and answer section. Multiple choice questions and answers on iron metabolism. I am Dr. Ifeanyi Mary Ann Okafor from the Department of Hematology and Blood Transfusion Science, College of Medical Sciences, University of Calabar, Nigeria. Please, if you have not subscribed to our channel, feel free to hit the button now, subscribe, like, share, and also comment. Your feedback will help us to get better. Thank you very much. The first question says, what is the primary site of iron absorption in the body? We have option A, stomach, duodenum, ileum. Answer B, duodenum. Iron is absorbed in the proximal duodenum part of the small intestine. Het monomers of ferritin are predominantly found in the plasma, serum, liver, hemoglobin, myoglobin. Answer A, plasma. Het monomers of ferritin are predominantly found in the plasma. Remember, het monomers of ferritin has the capacity to grab iron readily and also release it readily. And they are found in those areas where iron is needed to be made available, like in the plasma. Proteins that transport iron are hemoglobin and myoglobin, lactoferrin and hepcidin, transferrin and hemosiderin, transferrin and lactoferrin, lactoferrin and ferritin. Answer D, transferrin and lactoferrin. Transferrin is protein that transports iron in the blood, while lactoferrin is the protein that transports iron in milk. L monomers of ferritin are predominantly found in the plasma, serum, liver, kidney, bone marrow. Answer C, liver. The L monomers of ferritin is predominantly found in the liver, where iron is stored. Transport iron constitutes how many percent of total body iron? Remember, transport iron is iron found in the body as part of transferrin. The options we have, and then the answer is C, The transport ion constitutes 0.08% of total body iron. Which of the following is the most common form of iron in the body? Ferrous iron, ferric iron, heme iron, non-heme iron. Answer B, ferric iron. Which of the following proteins is responsible for transporting iron in the blood? Transferrin, ferritin, hemoglobin, myoglobin. Answer A, transferrin. Transferrin is responsible for transporting iron in the blood. What is the storage form of iron in the body? We have transferrin, ferritin, hemoglobin, myoglobin. Answer B, ferritin is the storage form of iron in the body. Iron is stored in the body as ferritin and hemosiderin. Which of the following is a genetic disorder that results in increased iron absorption and deposition in various organs? Hemochromatosis, anemia, thalassemia, sickle cell disease. Answer A, hemochromatosis. What is the function of hepcidin in iron metabolism? A, increase iron absorption in the intestine, decrease iron absorption in the intestine, release iron from ferritin stores, transport iron to cells. Answer B, decreases iron absorption in the intestine. Ferritin, hepcidin is the chief regulator of iron absorption. It decreases iron absorption in the intestine. When ferritin level is high, the rate of iron absorption is reduced. Which of the following vitamins is important for optimal iron absorption? Vitamin A, vitamin B12, vitamin C, vitamin K. Answer C, vitamin C. Vitamin C is a reducing agent and it helps in reducing iron 3 that is found in our diet to iron 2 for it to be readily absorbed across the duodenal enterocytes. Which of the following is a common symptom of iron deficiency anemia? Jaundice, hematuria, fatigue, hypertension. Answer C, fatigue is a common symptom of iron deficiency anemia. Which of the following is a condition characterized by low level of hepcidin and excess iron absorption? Hemochromatosis, iron deficiency anemia, sickle cell disease, thalassemia. Answer A, hemochromatosis. Which of the following food is a good source of heme iron? Spinach, lentils, beef, whole grain. Answer C, beef is a very good source of heme iron. Remember, heme iron are found in food of animal origin. The protein that contains largest amount of iron in the body is hemoglobin, myoglobin, heptoglobin, transferrin. Answer A, hemoglobin is the protein that contains the largest amount of iron in the body. What is the primary site of iron absorption in the human body? Stomach, small intestine, large intestine, liver. Answer B, small intestine is the primary site of iron absorption in the body. The proximal duodenum is actually the site of iron absorption, is a part of a small intestine. Which type of dietary iron is more readily absorbed by the body? Heme iron, non-heme iron, ferrous iron, ferric iron. Answer A, heme iron is readily absorbed by the body than any other form of iron. Which hormone is the main regulator of iron homeostasis? Insulin, tyrosine, calcitonin, hepcidin. Answer D, hepcidin. Iron deficiency anemia is characterized by this type of red blood cells: A, normocytic normochromic red cells, macrocytic hypochromic red cells, microcytic hypochromic red cells, macrocytic normochromic red cells. Answer C, microcytic hypochromic red cells. Iron deficiency anemia is characterized morphologically by microcytic hypochromic red cells, though it is not the only thing that causes microcytosis or hypochromic red cells. But the classical picture of a patient with iron deficiency anemia is characterized by microcytic hypochromic red blood cells. Which iron storage protein is found primarily in the macrophages? Hemosiderin, myoglobin, ferritin, transferrin. Answer C, hemosiderin. Which iron storage protein is found primarily in the macrophages? The answer is A, hemosiderin. The answer is A, hemosiderin. The answer is A, hemosiderin. Hemosiderin is found primarily in the macrophages. Which enzyme is responsible for converting ferrous iron to ferric iron in plasma? Ferritin, heme oxygenase, cellular plasmin, hepcidin. Answer C, cellular plasmin. Cellular plasmin is responsible for converting ferrous iron to ferric iron in the plasma. Which enzyme is responsible for converting ferrous iron to ferric iron at the duodenal enterocyte for binding to transferrin? Ferritin, heme oxygenase, cellular plasmin, hepcidin. Answer D, hepcidin. Hepcidin is responsible for conversion of ferrous iron to ferric iron at the duodenal enterocyte for binding to transferrin. Which of the following is not a symptom of iron deficiency anemia? Fatigue, pale skin, shortness of breath, high blood pressure. Answer D, high blood pressure. Which enzyme is responsible for converting ferrous iron to ferric iron in the placenta? Cyclopen, heme oxygenase, cellular plasmin, hepcidin. Answer A, cyclopen. Which of the following factors enhances the absorption of non-heme iron? Vitamin C, calcium, fiber, phytates. Answer A, vitamin C increases the absorption of non-heme iron because it enhances the reduction of iron 3 to ferrous iron. Which of the following minerals can inhibit the absorption of non-heme iron? Calcium, zinc, copper, magnesium. Answer A, calcium. Calcium inhibits the absorption of non-heme iron. Which of the following substances can enhance the absorption of non-heme iron? Tannins, phytates, calcium, vitamin D. Answer D, vitamin D. Which of the following conditions can increase the absorption of iron? Iron deficiency, inflammatory bowel disease, hemochromatosis, chronic kidney disease. Answer A, iron deficiency. When the body is in a state of negative iron balance, the absorption of iron from the proximal duodenum is enhanced. Which of the following cooking method can increase the bioavailability of non-heme iron? Boiling, grilling, stir frying, steaming. Answer D, steaming. Which of the following factors can affect the absorption of heme iron? Fiber content of the diet, presence of phytates in the diet, presence of vitamin C in the diet, none of the above. Answer D, none of the above. What is the function of the iron regulatory protein in iron homeostasis? Regulate iron uptake in the intestine, regulate iron storage in ferritin, regulate iron export by ferroportin, all of the above. Answer D, all of the above. Iron regulatory protein are involved in regulation of iron uptake in the intestine, iron storage in the ferritin, and iron export by the ferroportin. What is the main transporter protein responsible for exporting iron out of cell? Transferrin, ferroportin, hepcidin, heme oxygenase. Answer B, ferroportin. In which cell type is the majority of the body iron stored? A, red blood cells, white blood cells, liver cells, muscle cells. Answer C, liver cells. Most of the iron are stored in the hepatocytes, that is the liver cells. What is the primary dietary source of heme iron? Meat, leafy green vegetables, nuts and seeds, legumes. Answer A, meat is a very good source of heme iron. What is the name of the iron-containing pigment found in the red blood cell? Hemoglobin, myoglobin, cytochrome C, catalase. Answer A, hemoglobin. What is the name of the condition characterized by low iron levels in the body? Hemochromatosis, sideroblastic anemia, thalassemia, iron deficiency anemia. Answer D, iron deficiency anemia is characterized by low iron levels in the body. Iron deficiency anemia is most commonly caused by blood loss, acute illness, chronic illness, genetic mutation. Answer A, blood loss. Iron deficiency anemia most likely to be caused by blood loss. Iron is necessary for the body to produce which of the following? Hemoglobin, enzyme, myoglobin, all of the above. Answer D, all of the above. Iron is needed in hemoglobin production, production of different enzymes in the body, and of course, production of myoglobin. Iron deficiency anemia is most commonly diagnosed by which of the following tests? Complete blood count, blood glucose test, urine analysis, X-ray. Answer A, complete blood count. Which of the following food is a good source of dietary iron? Spinach, bananas, bread, cheese. Answer A, spinach is a good source of non-heme iron. Which of the following populations is at risk for iron deficiency anemia? Adolescent girls, middle-aged men, elderly women, newborn babies. Answer A, adolescent girls. Iron supplements are typically taken before meals, after meals, with meals. It does not matter when they are taken. Answer C, with meals. Which of the following conditions can mimic the symptoms of iron deficiency anemia? Vitamin B12 deficiency, hypothyroidism, chronic kidney disease, all of the above. Answer D, all of the above. Which of the following is a potential complication of iron deficiency anemia in pregnant women? Low birth weight, gestational diabetes, preterm labor, all of the above. Answer D, all of the above. Iron deficiency anemia can lead to low birth weight in pregnancy, giving birth to children with low birth weight, gestational diabetes, preterm labor, and other negative pregnancy outcome. What is hemochromatosis? What is hemochromatosis? A disease caused by overproduction of red blood cell, a condition that causes excessive iron absorption by the body, a disorder that affects the blood clotting process, a syndrome that causes abnormal heart rhythm. Answer B, a condition that causes excessive iron absorption by the body. What is the main cause of hemochromatosis? What is the main cause of hemochromatosis? Inheritance of mutated gene, exposure to environmental toxins, viral infection, poor dietary habits. Answer A, inheritance of a mutated gene. Which of the following is a symptom of hemochromatosis? Cirrhosis, chronic fatigue, diabetes, all of the above. Answer D, all of the above. Symptoms of hemochromatosis include, but not limited to, cirrhosis, chronic fatigue, diabetes, hyperpigmentation, and others. Which of the following is diagnostic of hemochromatosis in men? Ferritin greater than 300 microgram per liter, ferritin greater than 200 microgram per liter, ferritin less than 300 microgram per liter, CT scan. Answer A, ferritin greater than 300 microgram per liter is diagnostic of hemochromatosis in men, in addition to presentation of other clinical symptoms. Which of the following is a treatment option for hemochromatosis? Blood transfusion, phlebotomy, corticosteroid, surgery? Answer B, phlebotomy. Which of the following organ is most affected by hemochromatosis? Liver, lungs, kidney, pancreas? Answer A, liver. Which of the following is a risk factor for developing acquired hemochromatosis? Obesity, smoking, heavy alcohol consumption, all of the above? Answer D, all of the above. What is the life expectancy of individual with untreated hemochromatosis? Normal life expectancy, 5 to 10 years, 10 to 20 years, less than 5 years. Answer B, 5 to 10 years. What is the most common genetic mutation associated with hereditary hemochromatosis? HFE C2A2Y allele, HFE H63D allele, HAMP IRE, TFR2A205AG allele. Answer A, HFE C2A2Y allele. In what organ does iron overload typically manifest in hemochromatosis? Liver, spleen, lungs, kidneys? Answer A, liver. What laboratory test is typically used to diagnose hemochromatosis? Complete blood count, ferritin level and percentage transferrin saturation, bilirubin and protein level, creatinine level and liver enzyme test. Answer B, ferritin level and percentage transferrin saturation. Which of the following is a common clinical manifestation of hemochromatosis? Cardiomyopathy, diabetes mellitus, arthritis, all of the above. Answer D, all of the above. Which of the following is not a treatment option for hemochromatosis? Phlebotomy, ion chelation therapy, immunotherapy, none of the above. Answer C, immunotherapy is not a treatment option for phlebotomy, patients with hemochromatosis. What is the recommended frequency of maintenance phlebotomy for patients with hemochromatosis? Once a week, once a month, once every 3 months, once every 6 months. Answer C, once every 3 months. The maintenance phlebotomy for patients with hemochromatosis is once every 3 months, at most once every 4 months. What is the target ferritin level for patients undergoing phlebotomy for hemochromatosis? Ferritin level less than 50 nanogram, less than 100, 200, and 500. Answer A, the target should be ferritin level less than 50 nanogram per ml. What is the risk of developing hepatocellular carcinoma in patients with hemochromatosis? No increased risk, 2 to 4 times increased risk, 5 to 10 times increased risk, greater than 10 times increased risk. Answer D, more than 10 times increased risk. What is the recommended screening test for family members of a patient with a hemochromatosis? Complete blood count, ferritin level, genetic testing, liver function test. Answer C, genetic testing. What is the main function of iron in the human body? It is essential for the production of white blood cell. It is necessary for the production of red blood cell. It helps to regulate blood pressure. It is important for muscle contraction. Answer B, it is necessary for the production of red blood cell. Where is transferrin synthesized? In the liver, in the spleen, in the bone marrow, in the intestine. Answer A, in the liver. Transferrin is synthesized in the liver. What is the ion binding capacity of transferrin? 2 milligram per liter, 20 milligram per liter, 200 milligram per liter, 2000 milligram per liter. Answer D, 2000 milligram per liter. What is the most common type of hemochromatosis? Idiopathic hemochromatosis, secondary hemochromatosis, hereditary hemochromatosis, acquired hemochromatosis. Answer C, hereditary hemochromatosis. Which gene is mutated in type 1 hereditary hemochromatosis? HFE gene, HAMP gene, HJV gene, HBB gene. Answer A, HFE gene. What is the normal range of serum ferritin in adult male? 10 to 50 nanogram per ml, 50 to 150, 150 to 300, 300 to 500. Answer B, 50 to 150 nanogram per ml. What is the name of the disorder characterized by a defect in heme synthesis that leads to abnormal iron accumulation in the mitochondria of erythroid precursors? 1, hemochromatosis, sideroblastic anemia, thalassemia, pernicious anemia. Answer B, sideroblastic anemia. Which gene is mutated in type 2A hereditary hemochromatosis, HFE gene, HAMP gene, HJV gene, TRF gene. Answer C, HJV gene. That is, hemojuvelin gene is mutated in type 2A hereditary hemochromatosis. What is the name of the iron-containing protein found in muscle cells? Transferrin, ferritin, hemoglobin, myoglobin. Answer D, myoglobin. Which gene is mutated in type 2B hereditary hemochromatosis? HFE gene, HAMP gene, HJV gene, ferroportin gene. Answer B, HAMP gene. That is, hepcidin antimicrobial peptide gene is mutated in type 2B hereditary hemochromatosis. Which of the following can lead to iron deficiency anemia? Heavy menstrual bleeding, pregnancy, chronic gastrointestinal bleeding, all of the above. Answer D, all of the above can lead to iron deficiency anemia if the intake is less than what is needed. Iron deficiency anemia will actually eventually develop. What is the name of the test that measures the amount of iron stored in the body? Complete blood count, serum ferritin, hemoglobin, glycosylated hemoglobin, liver function test. Answer B, serum ferritin can be used to estimate the amount of iron that is stored in the body. What is the gene that is mutated in type 3 hereditary hemochromatosis? HFE gene, HAMP gene, HJV gene, TRF gene. Answer D, TRF gene. Transferrin receptor, soluble transferrin receptor gene is responsible. The mutation in this gene is responsible for type 3 hereditary hemochromatosis. What is the gene that is mutated in type 4 hereditary hemochromatosis? HFE gene, HAMP gene, HJV gene, ferroportin gene. Answer D, mutation in ferroportin gene is responsible for type 4 hereditary hemochromatosis. Which of the following is the cause of iron deficiency anemia? Inadequate dietary intake of iron, blood loss, impaired iron absorption, increased demand for iron during growth and pregnancy, all of the above. Answer E, all of the above. Which of the following laboratory findings is most suggestive of iron deficiency anemia? Increased serum iron, decreased serum ferritin, decreased total iron binding capacity, increased red blood cell counts. Answer B, decreased serum ferritin is suggestive of iron deficiency. Which of the following is a classic sign of iron deficiency anemia? Glossitis, chylomicria, jaundice, petechia. Answer B, chylomicria. Which of the following is a common cause of iron deficiency anemia in male? Menorrhagia, pregnancy, chronic gastrointestinal bleeding, none of the above. Answer C, chronic gastrointestinal bleeding. Which of the following laboratory tests can be used to monitor treatment response in iron deficiency anemia? Hemoglobin level, serum ferritin level, total iron binding capacity, all of the above. Answer D, all of the above can be used to monitor treatment level where they are available. Mutation in these genes can cause hereditary hemochromatosis. 1, hemostatic ion regulation gene, hepcidin antimicrobial peptide gene, hemojuvelin gene and ferroportin gene, transferrin receptor gene, all of the above. Answer: E, all of the above. What are the causes of hemochromatosis? Excess dietary iron, excess blood transfusion, mutated gene, all of the above, none of the above. Answer: D, all of the above, all of the above is the answer. Non-HFE hemochromatosis includes the following except type 1 hemochromatosis, type 2 hemochromatosis, type 3 hemochromatosis, type 4 hemochromatosis. Answer: A, type 1 hemochromatosis is not a non-HFE hemochromatosis. Non-HFE hemochromatosis includes mutation in the following genes except A, hemostatic ion regulation gene, B, hepcidin antimicrobial peptide gene, C, hemojuvelin gene, D, ferroportin gene, E, transferrin receptor gene. Answer: A, hemostatic ion regulation gene. HFE hemochromatosis involves mutation in the following gene. The HFE: A, hemostatic ion regulation gene, B, hepcidin antimicrobial peptide gene, C, hemojuvelin gene, D, ferroportin gene, E, transferrin receptor gene. Answer: A, hemostatic ion regulation gene. The mutation in this gene causes juvenile hemochromatosis. The mutation in this gene causes juvenile hemochromatosis. Hemostatic ion regulation and ferroportin gene, hepcidin antimicrobial peptide and hemojuvelin gene, ferroportin and transferrin receptor gene, transferrin receptor and hemojuvelin gene. Answer: B, hepcidin antimicrobial peptide and hemojuvelin gene. The mutation in hepcidin antimicrobial peptide and hemojuvelin gene give rise to type 2 hemochromatosis, also known as juvenile hemochromatosis. These types of hemochromatosis start in adult life. Type 2 and type 3 hemochromatosis, type 1 and type 4 hemochromatosis, type 1 and type 3 hemochromatosis, type 3 and type 4 hemochromatosis, all of the above. Answer: B, type 1 and type 2 hemochromatosis starts in adult life from between 40 to 60 years of age, or in women that are postmenopausal women. So the answer is B, type 1 and type 4. This is also called juvenile hemochromatosis. Type 1 hemochromatosis, type 2 hemochromatosis, type 3 hemochromatosis, type 4 hemochromatosis, type 5 hemochromatosis. Answer: B, type 2 hemochromatosis is also known as juvenile hemochromatosis. Onset of type 3 hemochromatosis is adult life, childhood, intermediate years, postmenopausal women, congenital. Answer: C, intermediate years. Type 3 hemochromatosis occurs in intermediate at around 30 years of age. So intermediate years is the correct answer. The type of hemochromatosis that is autosomal dominant disorder is type 1, type 2, type 3, type 4, none of the above. Answer: D, type 4 hemochromatosis is known as autosomal dominant disorder. Autosomal dominant disorder, type 4 hemochromatosis. These hereditary hemochromatosis are autosomal recessive disorder, except type 1, type 2, type 3, type 4. Answer D, type 4. Every other type of hemochromatosis, type 1, type 2, type 3, are all autosomal recessive disorder, except type 4, who is a dominant disorder. Sequence of events to the development of iron deficiency anemia are: 1, depletion of iron stores, iron deficient erythropoiesis, iron deficient anemia. 2, reduction in serum iron, ferritin reduces iron deficiency anemia. 3, reduction in TIBC, reduction in serum iron, iron deficiency anemia. 4, reduction in MCV, reduced MCH, iron deficiency anemia. 5, reduced protoporphyrin ring, reduced TIBC, iron deficiency anemia. Answer A, depletion of iron stores, iron deficient erythropoiesis, and iron deficiency anemia. These are the sequence of events to development of frank iron deficiency anemia. First, there must be depletion of iron stores, and then there must be iron deficient erythropoiesis, and then frank development of iron deficiency anemia. The gene that codes for hepcidin production is HAMP gene, HFE gene, SLC40A1 gene, ferroportin gene, TMMSS gene. Answer A, HAMP gene, that is hepcidin antimicrobial peptide gene, is the gene that codes for the production of hepcidin. The enzyme that converts ferric iron in our diet to ferrous iron in the duodenum is duodenal cytochrome B, duodenal DMTI, duodenal cyclosis, duodenal oxalasis, duodenal hemoxasis. Answer A, duodenal cytochrome B. The protein that transports non-heme iron across the duodenal mucosal membrane is DMT1, BMP6, SMAD, DCTT1, none of the above. Answer DA, DMT1. The answer is A, that's divalent metal transporter 1. Divalent metal transporter 1 is responsible for transport of non-heme iron across the duodenal mucosal membrane. Hepcidin acts on this protein to control efflux of iron out of cells. Efflux of iron out of cell. Hepcidin, cellular plasmin, ferroportin, cyclopen, none of the above. Answer C, ferroportin. Hepcidin acts on ferroportin to control the flow of iron in and out of cell. Factors that modulate the transcription pathway of HAMP gene are hypoxia and erythropoietin, iron concentration and anemia, inflammation, all of the above, none of the above. Answer D, all of the above. All these factors can modulate transcription pathway of hepcidin antimicrobial peptide gene. All of the above is the answer. This signaling pathway is a major transcriptional regulator of hepcidin expression that controls hepcidin production in response to most of its known regulatory signals. The BMP-SMAD signaling pathway, interleukin-2 signaling pathway, JAK/ST80 signaling pathway, none of the above, all of the above. Answer A, the BMP-SMAD signaling pathway. The transferrin receptor complex is internalized within the cell through a process called endocytosis, phagocytosis, cryptocytosis, opsonization, cellulocytosis. Answer A, endocytosis. Hemoglobin constitutes what percentage of total body iron? 58%, 67%, 75%, 55%, 47%. Answer B, 67%. Hemoglobin constitutes 67% of the total body iron. Thank you very much. I hope that you have learned a lot from this, and I hope that this question and answers will help you to do revisions for your exams. Thank you very much. Please don't hesitate to like our videos, drop your comments, and also subscribe if you have not done so. Thank you and thank you.